We are very pleased to be able to have Ingrid here with us today, and from her perspective, being such a valuable one, just to the goings-on, right, from the federal system and the side within HHS, and specifically Region 10. So I would encourage, as people are coming in, kind of move towards the front. These microphones are gonna get used a lot, so please be ready kind of for that call out to come and engage. And with that, I will turn it over to Ingrid.
Great, Carter, thank you so much. Can everyone hear me okay? Well, congratulations. You've made it through almost the entire day of this conference, and you've been attentive, and you've listened, and you've learned and asked questions. And there's a lot I don't even need to present because you've already talked about it. So I have the joy of being the last, and best thing is the last is fast. So I'll keep it at a pretty good clip. I'm just gonna provide some background and context, and then I'm gonna highlight three top priorities for HHS Secretary Javier Becerra. And I'm just gonna pause after each one, and I want us to have some conversations. I really want this to be a two-way channel. I wanna hear any questions you have about the three issues I'm gonna highlight. And I want to hear any comments or some of your experience about how you're working on these same priorities. So if you will, let's make it a conversation. So thanks again for the introduction. Again, I was appointed by the Biden administration about 8 months ago to be the director of HHS Region 10. Let me take a minute to explain. Oh, my advancer is?
Green is go.
Green is go.
Red is
okay. Okay, I advanced. Okay. There we go. All right, so just a little context here. So HHS is literally an alphabet soup of a number of major federal public health, research, and service provision agencies. Many of you in this room are familiar or work closely with CMS or SAMHSA, CDC, or HRSA. This collection of agencies really has a huge impact on the health and well-being of people across the nation. And like a lot of the larger federal agencies, HHS, hang on, I'll get this, there you go, divides the country into 10 geographical regions. So the region that I represent is your great state of Washington and mine, because I live in Seattle, as well as Oregon, Idaho, and Alaska. And in addition, 272 federally recognized tribes. Interesting factoid, Region 10 is the home geography of the majority of all tribes in the nation, not of the tribal population, because back east in the Navajo tribe and others, we have some very large tribes, but we have a number of very small tribes and just a large variety of tribes, especially in Alaska. Working with the tribes has been really one of the most rewarding and interesting parts of this job for me. The Biden administration really takes seriously the honoring of the federal trust responsibility, the federal government to government relationship with the tribes, and the consultation process. So I'm gonna start with this slide. I thought because it's so late in the day, to keep your attention, we should play a little game. Would you mind? So I'm gonna show, I just threw a bunch of pictures into this presentation, and I tried to choose quite a few that are Washington State specific for you. So each time I show a picture, I'm gonna say, who recognizes someone in this photo? Raise your hand. Excellent, who do you see? Oh, yeah, that's true, I am in a lot of these. However, this is actually a group of tribal leaders, in addition to myself. And I just want to point out that we have had the chairman, Ron Allen, of the Jamestown Sklallam tribe, as well as Colville tribe council member Andy Joseph, who's with the Colville tribe right near here. And they are actually, the two of them are represented on the national Tribal Advisory Committee to Secretary Becerra. And I just want people to know that some of our local tribal leaders also have a lot of impact on national policy, and that's just an important part of the process and honoring their history and our relationship with the tribes. Okay, who recognizes the person in this picture? A few of you. Anyone else? Okay, so that is Secretary Javier Becerra, my boss, and I'm going to just here's the three issues that we're going to have conversation about. These are three of Secretary Becerra's top priorities, as well as priorities for the Biden administration. So the first is maintaining a strong and well-coordinated COVID response. Number two, issue two, addressing the behavioral health challenges that have deepened during COVID. And issue three, I kind of threw a few together here, advancing health equity and expanding healthcare coverage and access. So let's dive into these. Let's first talk about COVID. I just want to acknowledge one is just COVID exhaustion, right? So we've all been through a lot with this pandemic. Prior to this appointment, I worked for 5 years for Public Health Seattle King County, where I was the policy director. And I was appointed the chief of the response to outbreaks in long-term care facilities, which was just heartbreaking to see so many of our elders and people with disabilities dying in large numbers. Every day I would report the number of deaths, and this was pre-vaccine. So I want to acknowledge that for me, working in local public health under the prior administration, I personally saw a big difference. My last year was under this administration, of this sense of a national strategy. Who recognizes the people in these pictures? Okay. So you know that the administration it has a COVID response team led by Dr. Ashish Jha in the White House with leaders from HHS that I've represented here in the slide, including the Surgeon General and Dr. Walensky from CDC. The work that has happened in this administration to ensure access to vaccine, treatments, and testing has been a huge, huge effort. We've made a lot of progress, but the reality is, even though mitigation measures have been relaxed and we're all sitting in this room in person and most of us not wearing masks, the reality is we still have 300 to 500 people a day dying from COVID. And we have an increased risk of outbreaks this fall as people go back indoors and as our immunity wanes, because it's been a long time for many of us since we've been had our vaccine series. The key thing at this moment, and it's all over the news, and I just want to highlight it, is the announcement of the new vaccines. It's very exciting that we now have the new bivalent vaccine coming out really just this week. I've been getting a lot of email traffic about it, a lot of excitement. One thing that caught my attention the most that I will just share with you is the FDA shared some predictive modeling, looking at what if by October 31st, with the new vaccine, the uptake rate was equivalent as what we had for flu vaccine last season. And what that predictive modeling found is that if we could make that happen together, we would avert 100,000 deaths and over 1 million hospitalizations and prevent 24 million infections. So the stakes are high. You know, a lot of the tools in our tool chest, the mitigation strategies have been relaxed. Really, vaccination is our most important course of action at this point. And sorry, I got a lot of things I'm juggling up here on my hands. I wanted to emphasize that the success of that whole endeavor and continuing to be vigilant to this response and to move towards recovery really lies with you. Sorry to put that heavy weight on your shoulders after a really long day, but you are the trusted messengers. So you who are healthcare providers, state officials, FQHCs, community-based organizations, You are the ones that people will listen to. And the best hope that we have to save lives this fall, this winter, is to get people to return for that shot and for them to start getting a mentality of, well, this is just like the flu shot. Every year somewhere between August and Labor Day and the end of October, I go and I get my COVID vaccine. And every year the scientists track the evolution of the variant and make it as effective as possible based on that research. So you're the trusted messengers. And here's just a picture. So who recognizes anyone in this picture? Some of you might work for one of the gentlemen in that picture. Oh, David, you recognize someone in that picture? Yes. So that is, this picture is actually myself and Renee Bouvion, who is one of my colleagues in Region 10 who works for the Assistant Secretary. And those are the state health officers, the shows, for each of the states in Region 10, as well as the woman in the flowery dress. She is the state health official for British Columbia, Canada. So one of the things that we do at Region 10 is gather with the state health officials regularly and communicate across the region. And that was a wonderful meeting. On the far is Dr. Enzing from Alaska. And then the person in the uniform, many of you may recognize her, is Admiral Rachel Levine, who is the HHS Assistant Secretary of Health and the leader of the Public Health Service Corps, has a major role to play in the COVID response, and notably is the highest ranking transgender federally appointed and approved by the Senate official ever. So I was really pleased to host her in Seattle and introduce her to our transgender leaders in Washington State. But let me pause. I would like to know, with this new booster, how are you feeling? It's hard out there. People are tired of this, tired of the same messaging. What questions do you have, which I may or may not be able to answer, but will get answered for you? And what strategies are you thinking about taking with your patients, your clients, your constituents? I want to hear from you. Carter and I, don't you want to hear from them, Carter? I really do. What are you going to do about this new booster?
I have a question. One of the things I've heard mention is that the COVID vaccine is not funded, and like the so just curious how the administration is considering, or perhaps not, some price controls on that, or not. Fairly novel. How are the costs?
Thank you. I'll call you Director Fatinos. One of the really challenging things about the response at this time is the President and the administration made a big ask to Congress for the funding that is really needed to continue this response, not only domestically, but to vaccinate people around the globe. Congress has not taken action on that funding request, which is really a huge matter of concern. You've seen some things change already. So the program to order free tests, we were lucky in Washington State that our state health department also shadowed that. So we had two options, but the federal program is now frozen and on hold and until we see saving those tests, free tests for potentially a later spot. Teresa, to your question, I don't have the answer. I think there's uncertainty. That's what I would say, because we know that Congress has not responded to the administration's request for full funding. The trajectory to where we continue to have the free vaccine through this national stockpile. It's unclear how we'll be able to continue that or when it will turn commercial, and that's going to be linked both to funding and layers of other issues related to public health emergency. Anyone else want to comment on COVID or booster, or what you're doing about the booster? Raise your hand if you plan to be, is this in your wheelhouse? Will you be speaking to your patients, clients, et cetera? Okay, a lot of people in your wheelhouse. Love to hear from you. Tell me, and I just want to be flexible here because it's cookie hour. I could talk about monkeypox. Who would like to hear about monkeypox? Okay, let's talk about monkeypox. Hang on. I just threw this in here under the topic of COVID because, yet again, another infectious disease of concern is spreading. A couple things about it. One is that aggressively responding to this outbreak has been a critical priority for HHS. As of September 1st, nearly 20,000 monkeypox cases have been reported in the US. On August 4th, HHS Secretary Javier Becerra declared the ongoing spread of monkeypox as a public health emergency. And that simply strengthens and accelerates our ability to recognize the transmission and to more quickly move resources and supply chains. Before I tell you 3 quick trends on monkeypox, anybody recognize anyone in that picture? In addition to me? Well, I'll tell you, thank you. Well, this is a great example of partnership between federal and state health partners. So this was an event organized by the Washington State Department of Health and hosted by Gay City, Seattle's LGBTQ Center, to get feedback directly from community about monkeypox and how to communicate about it. So in there, again, is Director Shaw, as well as other folks from Washington State DOH and LGBTQ plus leaders in Washington. And the major theme that we heard that day was, this is not a gay disease. This is a human disease. So please find ways to talk about this that are not stigmatizing to the community that has been hit hardest, which overwhelmingly is men who have sex with men, particularly with multiple partners. So find that balance. We have to target the communications to people most at risk, but do so in a way that isn't stigmatizing. So I hope that's helpful. I did want to touch on monkeypox. That generally, supply chain for the monkeypox vaccine has improved. That was a struggle in the beginning. Initial indicators of data indicate a dipping of cases in some of the bigger cities where we've seen outbreaks. But we don't know yet if the outbreak has crested. And we continue to see MSM, men having sex with men, impacted disproportionately, and spread to the general population has been very limited. So that's what we know about monkeypox. I just squeezed that in under the topic 1, COVID. I hope you don't mind. Yes, please.
So has there been an improvement in the availability of the vaccine for monkeypox?
Yes. It's still focused on
Ingrid,
priority populations who have been
repeat the
disproportionately impacted.
Can you repeat the question?
Oh, sure. You were asking if there is still a shortage of the vaccine, can anyone get one? And the answer is there's still limited quantities, but it has become more robust, and they're still focused on priority populations most impacted. Okay. So let's switch to topic 2. There's been just an amazing and rich communication all day about behavioral health, mental health, and SUD, and I just want to thank you for that. In his State of the Union address, President Biden really called out that mental health, and when he said that, he really meant behavioral health, but no one understands what behavioral health means. Anyway, mental health is the defining health issue of our day. And that was actually a big thing for a president to say. And it hasn't only been words, it's been action. So there's been an enormous amount of fiscal investment in this direction, both through ARPA and most recently through the Bipartisan Public Safety Act, significant investment. And President Biden has really launched a whole of government strategy to strengthen mental health for all Americans. This has many different elements. I'll just call them out, and you've already really gone deep in some of the workshops today on these. One is addressing the chronic workforce shortages, which are challenging across healthcare, but I would say most deep in behavioral health and long-term care, I would note. The second is integrating behavioral health into primary care and schools. Thank you for the many rich discussions on that today. I want to call out that there has been some recent CMS guidance which sends the message to states of here's what we can do under current law to make it easier to bill for mental health services provided in schools. Following that guidance, CMS will be setting up a technical assistance center because it is incredibly cumbersome and most schools just don't have the bandwidth or the capacity. They don't have medical billing departments. CMS has a commitment to make this easier and more understandable, and there will be a technical assistance center as well as grants to states to facilitate how do we better leverage Medicaid, because there are many different models out there being tested to how to deliver mental health effectively in schools. I looked at some very closely up in Alaska, and they're wonderful. They're primarily funded by philanthropy, and they're just not sustainable. So how can we infuse them with more a braided funding approach, but with a stream that's more steady and more robust to carry them forward? So grateful to Washington State. Washington State's always far ahead, and I appreciate the work of the Children's Behavioral Health Work Group underway with a strategic vision and plan for this type of transformation. Shoring up the crisis system, let me talk about that in a minute, making parity real and addressing root causes. So these were all called out at the national level with follow-up steps across HHS operating divisions. It's been an exciting summer to see this summer the role. Oh, wait a minute. How do I go backwards, Carter? Because the red one? Okay. Who recognizes someone in this picture? They have masks. It's a bit challenging. Who is it? Can you tell us? And Tina Orwell. They're all wearing masks. So it is Representative Callan, Orwell, and Senator Dhingra. And is this Representative Macri back there? Hi. Okay, great. Well, you and these amazing women leaders in the state of Washington, I just want to say thank you for the incredible innovation of the state investments and the creative thinking about how we strengthen the mental health system. This picture was actually, Secretary Becerra came to Region 10 to Washington State and Oregon, and we had a great event at Crisis Connections in Seattle and talked to some of the call center workers about the 988 suicide and other crisis calls they were taking. It was very meaningful. Did the same thing in Oregon. But I was so glad that he had a chance to meet these leaders. Kashi, where are you, from Children's Hospital? You spoke at that event, and I thank you also for that. And Frontier Behavioral Health, Jeff, is he still here? Hello. So I just want to thank you for your leadership in the 988 rollout. And it was also great to visit your call center. The answering the calls is step one. So I think that what we found with the 988 rollout is nationwide an average of 45% increase in call volume. That is excellent news. The more people who call, the more people who get the help and the support they need, and we catch them before they fall. So it's really critical what's happening. Also, I know workforce has been a challenge, but you all are finding your way, and there's a lot of innovation happening on that front. It's the place to call. You guys know the Crisis Now model, and I know this is moving forward in Washington State. Also, for a small minority of the calls, it's really only about 2%. They require some kind of mobile team response, and then a place to go for some people to stabilize. There's been a lot of negative social media out there about you call 988 and the cops are going to come or they're going to take your guns or your children away. It's sad to see that. I think the reality is, again, it's 2% of the calls have a mobile team response, and the majority of those are voluntary, meaning the person has accepted and is welcoming that, and some are because there's an imminent threat to themselves or others. So this is a big effort and a big important effort. And complementary, so many people have the co-occurring challenge of both mental health and substance use. These are very, very intertwined issues. But as I've talked about with many, they are often bifurcated when they shouldn't be. Part of the national strategy led by SAMHSA is the overdose prevention strategy with these core pillars. I won't go into it, but I think you all are familiar with these. Prevention, harm reduction, I do want to call out because, and Dr. Fatinos, you had a different name for it earlier, and I appreciate your comment. But essentially, it's recognizing that no matter what we do, there are people who will be taking substances that could threaten their physical health. And we need to ensure, first and foremost, that they're safe and that they live. And then we can work on guiding them into treatment and recovery. So harm reduction or policies such as needle exchange or naloxone strips or, naloxone distribution or fentanyl strips, these are all really important. And Washington State's again ahead and has been a leader nationally, but what's new is SAMHSA is now very much giving their national footprint to this strategy and approach and has released a series of grants to states to support these types of harm reduction policies. Recovery as well, so important. I have to say I was very moved in one of my tribal visits to Merriman Health, which is just over in Coeur d'Alene, and they have a very rich healing program. And one example was taking people who are in recovery out for a family weekend of camping and picnic with no booze and no drugs. And the response I heard from the experience of people was like, this is so fantastic. I'm back with my family and we're out together and I'm happy. And I just thought it was just an interesting reflection on what recovery means. Okay, oh, there we go. Oh, before I move to that slide, I bet nobody knows this gentleman in the picture. Correct, because I don't either. But SAMHSA was using him for that photo, so I'm just saying that. On this huge, big, important issue of behavioral health, please, I would like to hear of those. It's a huge continuum of issues and services, but from the mental health to SUD and all around. Does anyone have any questions for me or recommendations to HHS of what is being done, what would be helpful and important to you to support what you're doing?
Good, thanks. I'm Rhonda Hoff from Yakima Neighborhood Health Services, Community Health Center in Yakima.
Yeah.
We have a robust street outreach team, and we've been part of a SAMHSA project for SUD and co-occurring disorders for the last 5 years. Been handing out naloxone for a long time as part of that. One of our challenges is we're one of the 24 states that cannot hand out fentanyl strips because it's not associated with the syringe exchange program. That belongs to our health district. One of the things that would be great is if in our state we had the ability to do that as being separate from needle exchange. So that would be a recommendation.
Thank you, and I'm glad our state officials are here also to hear that recommendation. Carter, I'm getting the yellow light. That means I need to get through topic 3 pretty fast, right?
It does.
Okay,
loosely.
that's okay.
Yeah.
That's okay, I can do it.
There's beer and wine and fancy snacks waiting.
Well, I
behind
don't
you,
want to
so
get in between these fine people
I was about to say.
and their beer and wine and fancy snacks. So health equity, coverage, access. You've had rich discussion today about the end of the PHE. You've heard repeatedly in different venues from state officials on the planning for the redetermination process and the effort to ensure that we reach people so that they understand that we need their latest information to make sure they're still eligible. I just want to emphasize one thing, is that consistent from the beginning of this administration, HHS has made it clear that they will provide 60 days notice prior to any possible termination or expiration in the future. So it's been a priority for the administration. The administration understands and acknowledges that after so many months now and years of not doing these redeterminations, this is a huge big deal. And I heard some specific examples today of providers and MCOs about how many clients or members they would lose coverage and their concern. So this is real. You need notice. The administration has committed to giving notice. It can now be presumed that the PHE will go through mid-October. And in fact, because it's currently in place, and given that the promise of 60 days, you can make the clear assumption it will be extended through January. So this is a challenge for all of us collectively in Q1, or beyond if it's further extended, we don't yet know. So that's all I'm going to say on that topic because you've had such good discussion. I don't know who this fine woman is also in the picture that my colleagues at CMS chose. And perhaps you probably don't either. Here we go. But you might know who this person is. How many people recognize this person? Oh my gosh, yes. And the other one, so I chose this picture, I thought it was kind of funny because he's giving the pen, you know who he's giving the pen to? Who? Joe Manchin. Okay, well, we won't go there, but I just thought that was kind of funny. These two topics are related because this Inflation Reduction Act is really the most exciting, biggest national health care policy that has passed since the Affordable Care Act. It's nowhere as near as big as was originally envisioned, but it's still going to be incredibly impactful. It impacts the end of the PHE because it extends the federal subsidies for 3 years. So I was speaking with the staff from the exchange earlier, Joan Altman and others, and everyone is very clear that that extension of those federal subsidies will play a large role in mitigating the loss of coverage for Washington State and other states. For people on Medicare, or those of us who may be on Medicare sometime soon, that would be all of us, hopefully, God willing, it has some incredibly meaningful provisions to reduce the cost of prescription drugs. I won't call them out, but you see them outlined on this slide. I spent 8 years working for AARP, and I know that for many of us, pushing for this policy to enable Medicare to negotiate for the cost of prescription drugs has been a decades-long fight for many, and it's very exciting to see it finally happen. And it falls right in the lap of CMS here at HHS, who will do the hard work of understanding how we implement these strategies. Carter, I'm trying to finish.
You're doing such a great job.
Okay, this one, here we go. How many people recognize people in the picture besides me and the bus? That is the Yakima Farm Workers Clinic folks and their mobile unit. I visited them about 6 months ago. The point here is we can have coverage through the ACA and people not losing coverage at the end of the PHE, improving Medicare, but you can have coverage but not access unless you have the workforce to provide it, and also access either by the mobile units that bring the healthcare to you or telehealth. So there was a lot of good discussion today also on telehealth and nervousness about what's going to happen with the flexibilities for telehealth at the end of the PHE. This is a really big, important issue. I want to call out that I'm hearing a ton about it here in Region 10, particularly in our frontier areas in southern Idaho and very much so in Alaska. How telehealth, as well as audio only, is critical to ensuring continued access to care. So this administration is working with Congress. We heard we don't have any definitive answers yet, but there's a strong push to continue these flexibilities. Reproductive rights was not talked about yet much today, and I'm not going to linger on it since we're running out of time, but I just want to acknowledge the enormous challenge that we're facing in this country, the choppy waters of confusion happening with the end of Roe v. Wade and the different policies in different states. I want you to know how that the president had an executive order around access to reproductive health, and it's really come to HHS to implement much of that order through the issuances of guidances to support access to reproductive health, from privacy guidelines to EMTALA guidelines, to also guidelines to pharmacies, to prevent some of the tragic stories that we've heard around the country of women or people in other states presenting, having with their life at risk, but physicians being so nervous about procedures, then procedures not happening, and people having bad health outcomes, or people going for drugs for something that's not going to fulfill a prescription for a health issue that has nothing to do with pregnancy, and pharmacists questioning that. So HHS is doing everything really in our power to both to emphasize what is possible under current law now, as well as this just information page that was released the day of the decision. And with the shot of the vice president, Next time I'm going to have someone else advance my
Yeah,
slides. Okay, so how many people recognize the woman in this picture? There she is, our Vice President, Kamala Harris. She's leading a big maternal health strategy. If we had time to talk more about health equity, I would linger here. And this is a whole conversation within itself, but I wanted to highlight it. And finally, I'm just going to end with the invitation to you to continue to move forward together. It was so fun to meet all of you today in person, and I met some of you last night. The role of the HHS regional directors and my office are to really make this huge government agency accessible to you. I know many of you work directly with CMS and SAMHSA and HRSA, and I just want you to know that with all the alphabet soup of HHS, if people have a question, a concern, or you need information or need connection, please know that my door is open. This is an example when we have visiting dignitaries like Secretary Becerra, or in this case, CMS Administrator Chiquita Brooks-LaSure. I am playing the role of bringing in people to meet with her. I bet many of you recognize these people. Anybody recognize these people? There's some Eastern Washington folks in there. We can go through later at the break over wine who's in that picture. But these are the major hospital associations, nursing home associations, and behavioral health council folks who we brought in to talk to Administrator Brooks-LaSure about a bunch of cross-cutting issues, including the difficult-to-discharge population and hospital capacity, and how that really is something that crosses all three of those sectors. So with that, I just really want to thank you for letting me be your closer today. It was super fun, and I hope that we can do this again next year.